Jonesy and Amanda.
Jam Nation.
Flu season is predicted to be a shocker, with 1 in 3 people tipped to get a cold or the flu. It's already 16% increase compared to this time last year. The Health Minister, Ryan Park, joins us right now to talk about the newly available flu vaccine. Good morning, Minister.
Good morning, Amanda. Good morning, Jonesy.
Hello, Ryan. I know that figure sounds a little alarming, but isn't that what we have every winter?
Well, we've seen a 16% increase, and unfortunately, it's come very early on in the season, and that's a concern, particularly for vulnerable members in the community, those with already existing conditions, and it also has a big impact on our health and hospital system. So we're urging people today, as we launch the campaign, to make some time with your GP or your pharmacist and go and get your vaccination.
How are people feeling about vaccinations? Are you finding, even anecdotally, that people are less likely to have shots now post-COVID? People are sick of all that and have been reading all the conspiracy theories. Is it making an impact?
Yeah, it is, Amanda. If we're brutally honest about it, it hasn't helped. Over the last couple of years, we are continuing to see people be a little bit hesitant about getting a vaccine. They shouldn't be. Vaccines are safe and, more importantly, effective, and they work here in New South Wales and in this country. And those people who have experienced flu will tell you it's a lot more than just a couple of sniffles and a sore throat and a cold. Flu can be very, very dangerous, put people into hospital, and that's why we want to make sure that people go and get their flu vaccination and protect themselves over the winter months.
Yeah, because I get my flu vaccination. I've been getting it since I remember when I turned 32, I was really run down. And the doctor said, have you ever had a flu shot? And I went, no, why would I get that? And he said, you should just get it. And I got the flu shot when I was 32, and I've had it ever since. So now I'm 56. And it's always worked for me. And then with light of COVID, so I'm getting the flu shot, but I'm deciding, because I've had, I think, 6 or 7 shots of the COVID vaccine. Am I at a point now where I'm feeling that I don't need to get the COVID shot anymore?
No, look, basically for adults who are reasonably healthy, every 12 months you should look at getting a booster for COVID. That's important. We know that COVID's still around. Obviously, as a society, we're learning to live with it, manage it, and deal with it. But COVID is still out and amongst our community, and it's important to have that protection and make sure you're protected. But also, the more people that are vaccinated, we get that herd immunity, where we try and also help protect vulnerable people from these illnesses.
Well, there you go. That's why we're sitting in our singlet and our underpants today, Minister.
We're ready for our shot.
Ready to go.
Ready to go.
I've had the flu vaccine, and I've had
Dr. Chant that I'll tell Dr. Chant you're ready to go.
Yes.
She'll come over personally.
Wow.
Cough.
That's a treat, isn't it?
But I've had my COVID and my flu, so yes, I'm up to date with all of that. I take that stuff very seriously.
Did you get one on each arm?
I did, and I got them both at the same time. The chemist said that's fair enough to do. It did knock me around. I've never had a response to a COVID vaccine before, but having both on that same day, my arm was really sore and I just felt a bit blur. But I thought, look, I would put up with that for getting it out of the way.
Our Health Minister, Ryan Park. Thank you very much for joining us, Minister.
Thanks a lot.